Heart surgery doesn't start in an operating room. It starts years earlier, often without symptoms. Yet for many people, it feels like it comes out of nowhere. One day you're managing life as usual, and the next, surgery is mentioned. But in reality, it's rarely sudden. It's the result of changes happening quietly over many years, long before symptoms are obvious. Understanding why surgery is needed helps reduce fear and gives context to what can otherwise feel overwhelming. Welcome back to the Cardiac Surgery Podcast by DelenHeart. This channel focuses on clear, practical explanations to help you better make sense of heart surgery, recovery, and long-term heart health. To understand how surgery becomes necessary, we first need to look at one of the heart's most important abilities: its capacity to adapt under unfavorable health conditions. The heart responds remarkably well to stress. When blood flow becomes limited, pressure rises or efficiency drops. The heart doesn't stop. It compensates. It pumps harder, adjusts timing, and finds ways to keep circulation moving. This is why many people feel fine for years, even as heart disease progresses. Surgery isn't considered at the first sign of trouble. It's considered when these compensations can no longer maintain safe circulation. Now, one of the most common pathways toward heart surgery develops quietly over time. A slow reduction in blood flow to the heart muscle, something most people don't notice at first. Plaque can slowly narrow the coronary arteries, the vessels that supply oxygen to the heart muscle. At first, oxygen supply meets demand. Over time, and even more so, during stress or activity, that balance begins to fail. The heart responds by working harder to meet the body's needs. But when blockages become severe or widespread, increased effort alone isn't enough. At that point, restoring blood flow becomes necessary, not because the heart suddenly failed, but because protecting heart muscle and circulation becomes critical. At this point, you might be wondering, what if there is no blockage, and blood can still move through the heart? Can a problem still exist? Well, yes. Even though blood may still move through the heart, it may no longer move forward the way it should, and over time, that still places strain on the heart. Heart valves act like doors, ensuring blood flows forward efficiently. When a valve becomes stiff or leaky, the heart has to generate extra force to move the same amount of blood. Initially, the heart adapts by thickening or enlarging muscle. This compensation can last for years. Eventually, the workload becomes too great. Surgery is considered when restoring efficient flow offers the best chance to reduce long-term strain and preserve function. If you find this video helpful, consider subscribing and sharing it with someone who may need it. It helps more people find clear, reliable guidance. Sometimes the heart looks normal, yet the timing of its beats creates a problem. Here's why. The heart relies on precise electrical timing to pump effectively. When rhythm becomes unstable, circulation suffers, even if the heart looks structurally normal. Persistent rhythm disturbances can reduce efficiency and increase risk. In certain cases, surgical or procedural correction becomes necessary to restore coordinated pumping and protect circulation. Not all hearts are built the same. Some structural features can dramatically affect how the heart works. Some hearts are born this way, while others develop changes over time. These conditions may be well tolerated early on, but as demands increase, compensation becomes harder. Surgery is used to restore balance, helping the heart function more safely over the long term. Ever wondered why heart surgery can feel sudden? Many people feel blindsided when surgery is mentioned. That's because the heart compensates so well that symptoms often appear late. By the time problems become noticeable, the underlying condition may already be advanced. The need for surgery can feel sudden, even though the process itself wasn't. Seen through this lens, it becomes clearer what heart surgery really represents. Heart surgery is not a failure. It's not a punishment. and it's rarely about one mistake. It's a tool used when restoring flow, structure, or stability becomes the safest way to protect the entire body. The goal isn't simply survival. It's preserving long-term function, quality of life, and systemic health. If you found this explanation helpful, you may find the other videos on this channel helpful as well. They're designed to bring clarity to heart health, surgery, and long-term recovery, without the overwhelm. For more clear, evidence-based explanations like this, you're welcome to subscribe. As always, until next time, stay healthy and take good care of your heart and health.